so people can come out. Hello. Admin, we are live. We are live for this evening session. Invite as many people as you can, because live this evening we've got Anyanna Ndukwe, who will be talking about sickle cells in Black and ethnic minority communities. My admin, can you please confirm that you can hear me and we are live? Santeza, can you please confirm that you can hear me and we are live? Santeza, are we live? Yes, we are live. Can you please invite as many people as we can, because we have our guest ready live this evening. Invite as many people as you can, because we are live. Invite as many people as you can, because we are live. Hello. We are live and we will be starting in 5 minutes. This evening the topic is about sickle cells in Black and ethnic minority communities. Please invite as many people as you can, because we are live. Mind, body and soul. As usual, we are live for your health and well-being. Thank you. We are live this evening to talk about sickle cells in Black and ethnic minority communities. Please join us this evening with our special guest, Anyanna Ndukwe, who is the founder of Sickle Cell Association here in Liverpool. We will be starting in 2 minutes' time. Do not miss this video, because it could be important to you or a close friend. So invite as many people as you can for this video. Admin, invite as many people as you can to join us this evening for sickle cells and mental health. Invite as many people as you can, because we will be starting in very few minutes. Our videos remain live, so you can access them on Facebook and YouTube if you've missed this video. Share with many people as you can, because this is very important information. Musharinge ka audio twogere ku bizibu ebiri very important mu bulamu bwaffe. A lot of people are sickle cell trait. Some families have people or children who suffer with sickle cells. This is the time to understand a few facts ebikwata ku sickle cells. Live this evening, Musawo Justine Kigozi with Anyanna Ndukwe in 3 minutes. Join us live this evening. Join us live this evening. Join us live this evening. We will be discussing issues in relation to sickle cell trait. Last Saturday we had a lot of people live with us talking. We were talking about mental health. This evening we'll be talking sickle cell traits, sickle cells, and psychological impacts of sickle cells on victim and family members. Join us live this evening. I would like to introduce Anyanna Ndukwe, who I will be asking a few questions live this evening. Anyanna.
Hello everybody, welcome to this evening's discussion about a very important issue, as you know, and an issue and a health impact that really affects 1 in 10 Africans globally will suffer from sickle cell. It's also reaching the Asian population as well, and the prevalence of that is thalassemia. Again, 1 in 7 within the Asian continent will suffer from sickle cell. Will suffer from thalassemia. Coming back to the African and the African diaspora, which includes African Americans and the Caribbean and British-born blacks, we're finding that the prevalence of sickle cell is still under investigated, and one that we are campaigning heavily to draw awareness for. Some of the key issues that is important to understand about sickle cell is it affects not just your body, but it also affects your mind, and therefore having an impact on your whole and total well-being. And many of our members who come to sickle cell, the community that we have set up, which is based in Liverpool, Toxteth, at a health centre, and it is at this health centre that we have opportunities to engage on a more friendly and holistic level. Many of our members are carers as well, and a couple of the families will perhaps have maybe 2 or 3 children that they look after in one family, which you can imagine the psychological, emotional pressures that they confront on a daily basis. Our role at Liverpool Sickle Cell and Thalassemia Group is to provide support, advice, guidance, and to signpost patients who perhaps don't feel that they're getting the necessary information from their GP. It has been brought to our attention as well that many of the health workers are ignorant to even sickle cell And there's a lot of education required in order to widen the knowledge through research, through education, so that we can impact and create a more visible experience and support. At the moment, what we have done is to campaign for free NHS prescriptions. Unfortunately, that was refused by the health minister, but we're not deterred. We will be pushing for changes within legislation to recognise the needs.
Just a quick question, Anyanna. How can we look after children or relatives who have sickle cells?
We created an app. It's called Little George and the Dragon, and I'll be able to leave the details for you. But it helps and teaches how you must support a child, for example, with lots of water. The basic advice is to be hydrated. That really helps with managing pain and managing crisis. And often the children or those who present are in crisis are given paracetamol, basic painkillers. Unless the pain is exaggerated, then it's increased doses of painkiller medication. So it's very important that you ensure you listen to your child and you make sure that they have lots of water. One of the other things is about keeping warm and regulating the body temperature, because that can really help and support to make one feel comfortable. Diet. It's very important that you maintain a very healthy diet. And a healthy diet doesn't mean you restrict yourself from everything, but just to have a balance of nutritious wholemeal foods that really does help to sustain the nutrition and the body's ability to sustain itself.
Okay. Kindly, can you tell us what are the psychological impacts of sickle cells on victims and relatives who are treating these people? Because it's very common that these children are in and out of hospital very often. They're receiving blood transfusions very often. They are in pain a lot of the time. What are the psychological impacts of sickle cells on the victims and the family and relatives?
That's a really emotive question, because obviously, as you can imagine, having to face on a daily and regular basis hospitalization is extremely discomforting. It's to the point where it can make you cry to watch your child in agony, and there's nothing that you can actually do about it. So the emotional trauma is heavy. It's also the burden for many parents who struggle to cope with working and managing the health of their child, and balancing that as well if you have more than one child, and maybe also the differentiator needs of your growing family. So the times that one is spent hours and hours in hospital, days, weeks, etc., has a really terrible emotional impact. And a lot of our parents complain about trauma, like being able to sleep themselves, the anxiety. Everything is very much hyper in terms of the sense of normality, not knowing from one crisis to the other how they're going to manage. Last year, one of our parents, her 12-year-old son, suffered a stroke following a crisis, and it took a lot of prayer. The church, everybody, we were there, confronted with a 12-year-old who had the symptoms of an elderly person. He pulled through, and miraculously he is back to normal. He didn't have any what is it now? It didn't leave itself any footprints.
Okay. Just a quick one, because you've mentioned going into crisis. What do we need to watch for if my son or my daughter has sickle cells? Are there any warning signs when they're going into crisis, or does it just appear?
It can happen within minutes, hours, or it can ebb into days. But the symptoms are chronic aches and pains in the joints, acute headaches and migraine, and even vision is blurred, not being able to have bright lights, etc. So it's very agonizing. You can see the deterioration immediately. How long the crisis lasts, that is very independent, and even with one child will experience variances in terms of the type of crisis they have and the longevity. It is more, the painful crises do happen in earlier childhood. However, and it does improve as the child grows older and becomes adult. The crises don't seem to be as often, but on the downside of that, it is more complex and more complicated. So this is where we have issues of elements of body failures, liver, kidney, etc. So it can affect the whole body and even have a shutdown often in some cases. And will need blood transfusion. One of the things as well that is very important is matching blood. Blood donorship is extremely difficult, and we try to campaign amongst our African and Caribbean communities to give blood. One of the parents mentioned that her child went into crisis, and she had to actually, the blood that saved her life came all the way from London, 350 miles. So this is the constraints in which the healthcare with the blood banking, it's limited resources.
Wow. That's very interesting, because you're saying that Black and African ethnic minorities sometimes could be admitted into hospital with sickle cells, but might not have a blood transfusion because they do not have a similar blood group to what they've got.
That's correct.
Which is really, really scary. Just a quick one before we close down, Anyanna. Of course, I get a lot of people watching from Africa, a lot of people watching, especially my Ugandan community. They watch me all the time. I'm just, wondering, what message do you have for my Ugandan community? Because what I can say in Africa, I don't know if it happens in Nigeria, but we pay for healthcare. So we pay for healthcare, and it's money out of pocket, it's expensive costs. Is there anything that we can do in the way we feed our children, in the way we look after our children, without that being a financial burden? Because also in Africa, it's well known that children with sickle cells have a very short lifespan. Is there something we can do to improve this?
Yes, we can help each other, work as a community. If somebody is your neighbor and you know that they have sickle cell, that person should, as African proverb, we should unite and work as a community to look after the well-being and the welfare of the family and the child. It is through that education and that support that will nurture the benefits of the child having a much better lifestyle. Of course, economics plays a big factor, and medicating scientifically isn't always the solution. So we must also look to see what natural, eating organic, healthy food that is rich in iron, rich in vitamins, rich in fiber. These are the things, if you encourage a good diet, you can actually help to sustain a child that's more healthier and able to fight or fight a crisis in the same way.
Wow.
And obviously water, it's very essential. It enables even within a crisis, it enables the red blood cells that have sickled to have easier passage. So you must hydrate, keep that child hydrated, drinking a good level of water on every day.
Wow. Wow. Thank you very much. I've quite learned a lot today and enjoyed myself. You all know that mind, body and soul is all about the health and well-being of an individual. I know lots of you say I'm a mental health nurse and what am I doing, dipping in all places and all sorts of things. Well, we are all about health and well-being. We are all about holistic care. So today, we've actually had Anyanna Ndukwe, who is the founder of the Sickle Cell Association here in Liverpool. Please share this video because I have learned some important things from this video today. Kakati ate, next week, eranja kuberako Musawo Justine Kigozi. Nayenga next week, we'll be talking about child upbringing and mental health. So share this video with friends because it's important. But what is also very important is that families with children who suffer with sickle cells go through a lot of psychological torture, psychological stresses, because you don't know whether your child will be alive tomorrow or not. You don't know if your child will be in crisis tomorrow or not. Your child is in and out of hospitals we've had for blood transfusions. And in countries like England, I'm sure it happens in USA and other countries where we are foreign to as black and ethnic minorities, you might arrive in hospital and your child does not have the same blood group, and it could take hours, days searching for blood to give to your child. So if you're out there living in England, living in USA, living in Australia, Canada, or anywhere, and you're black and ethnic minority, you're Asian, please, and you can donate blood, do donate blood to support children who suffer with sickle cells. See you next weekend. I remain Justine Nakimuli Kigozi. So Justine Nakimuli Kigozi, psychiatric nurse here in NHS England. Bye.